Speaker. My question is to the Minister for Health. I refer to the Auditor General's 2022 report, Management of Long-Stay Patients in Public Hospitals, which found WA does not have an effective system for managing long-stay patients and recommend urgent reforms in aged care and NDS transitions. And I ask, one, why is it that nearly 3 years after the report, the Cook Labor government continues to shift blame onto aged care patients for clogging our hospitals instead of fixing the system? And two, what specific actions have been taken to support aged care patients to transition out of hospitals, particularly in regional areas where services are greatly reduced?
Minister for Health.
Thank you, Member, for the question, because of course we're doing a lot in relation to aged care. We have been talking about it a lot in this place, and so it's correct. There is a rapidly ageing population in Western Australia. There are more people now in Western Australia who are older than there have been previously, and that is not just an issue for, obviously, our health system, but it is a challenge for a whole range of areas. So that is why we have spent a lot of time talking about how we need to do more in respect to aged care and the work that we're already doing. So just to put that in context for you, Member, in 2016 the proportion of Western Australians over 65 was 13.5%, and now it's more than 17%. So there is an increase in the ageing population, and we know
Members.
And we know it will continue to grow. We've talked in this place before about how that is one of the challenges for our health system, that our hospitals have a number of people in them who are older, and it is not the most appropriate place for them. They don't need to be in a tertiary hospital, but they don't have an appropriate place to receive the care that they need. On average, about 200 is the number, although it's peaked this winter at around 250 every week that are in that category in our health system where they don't need to be. But that's why we've been working on the question of aged care and appropriate care for some time. Now, I do want to be clear, though, it is a federal government responsibility. It is a federal government responsibility, aged care. And so that is why next week I'll travel with the Premier and the Minister for Aged Care to Canberra, because we do want the federal government to do more in relation to aged care beds, but to do more in relation to home care packages as well, which is a way that people can stay at home but receive appropriate care as they get older. But we haven't just been sitting around on our backsides, Member. We have been looking at a range of ways that we can provide support and assistance to older Western Australians. So that's why we've had the Time to Think program. So a nation-leading program, Member, that allows older people the time to make decisions about long-term care where they're outside of a hospital environment. So we've invested another $4.9 million on top of $5 million that was already there to expand and extend this initiative. Remember, we've made a record investment, $30 million into Transition Care Program, which again provides discharge pathways for older Western Australians. And of course, at the last election, we committed to a $1 million loan scheme to boost aged care infrastructure so that we could increase the number of concessional aged care beds over the next 4 years. So, Member, I've said in this place before, we're always looking at what more we can do. We are taking steps as a state government, but those steps also include making sure that we are advocating to the federal government for them to do more in this space, because by any measure their contribution to aged care is underdone in Western Australia.
Supplementary?
Supplementary question.
Mr. Speaker.
Yeah, I know.
Minister, we've seen this government make multi-million-dollar decisions overnight when the political pressure is on. Why do you keep dragging your feet when it comes to fixing aged care in our hospitals?
Sorry, Member, there's a point of order.
There's quite a large preamble to what is meant to be a supplementary question, which isn't allowed under standing orders.
Yes. I will uphold that point of order, Member. Supplementary questions don't have a preamble to them. They just have a very short and succinct question. So if you'd like to Try that again. That'd be
No
great.
worries. Why do you and the Labor government keep dragging your feet when it comes to fixing aged care in our hospitals?
Can you just listen to the answer?
Minister.
I mean, I just totally reject that we're dragging our feet. We're doing a range of things that are specifically addressing the needs of older West Australians, and I'm glad for the...
Member for Cottesloe, Leader of the Opposition.
I'm glad actually for the supplementary because I forgot to mention our older adult health hubs, which are another important initiative to provide care to older West Australians to ensure that they are able to age well. So we are doing a range of things as a state government. We understand this is such an important issue, not just because we want our older West Australians to be able to age with dignity, no matter where they live in this state, but because it is also a critical piece of the puzzle to ensure that we are doing everything we can to make sure that West Australians have got access to the healthcare that they need. That's why we'll go to Canberra and advocate for more. That's why we're looking for what more we can do here. But we're not sitting on our hands. We've got a range of initiatives designed to specifically address this problem, member.
Thank you. Minister.